Hi, my name is Amber and I'm doing my presentation on communication with a child who is autistic. My audience is Herb, Barb, Delsa, Kathy, Sandy, and Nathan. Communication is an important life skill to have. However, communication is a lot easier for some than it is for others. Have you ever thought of what it would be like if you couldn't talk? Or what it would be like if you had to come up with an alternative way to communicate with others? People with disabilities may need to use a different form of communication. In this presentation, I will be talking about how people with autism communicate. I will also explain what autism is, their social development, how some people with autism use pictures to communicate, and how to approach an autistic person who is verbal. First, I'm going to explain what autism is and how it affects the person and their ability to communicate with people around them. Autism is a developmental disorder where certain areas of the brain don't work together like they would normally. An individual with autism usually tends to have problems with communication. The communication level of an individual with autism varies depending on the severity of the disorder. In some instances, the person who is verbal, and in other cases, the person can be nonverbal. Autism has a wide range of symptoms that can be either very mild or, on the other hand, can be severe. Also, a person with autism will normally withdraw themselves from groups of people or peers and generally keep to themselves. Next, I will be talking about the social development of someone with autism. Children with autism tend to have a delay in their social interaction skills. A study called The Theory of Mind explains how an individual with autism is not able to understand that their thoughts, wants, and opinions are not the same as everyone else around them. It also explains how autistic children have a hard time understanding others' emotions and feelings even if they are told exactly how that person is feeling. This delay in interaction skills can make it hard for them to have relationships with peers. Because of the delayed interaction skills, it is harder for them to hold a conversation. They may feel embarrassed that they can't talk as well as others around them. They may even feel uncomfortable with talking around others at all. As we learned earlier, there are different levels of autism. A person who has a severe case of autism is most likely to be nonverbal. I will now talk about different ways to communicate with a nonverbal autistic person. There are many different ways for an individual who is nonverbal to communicate. However, the one way that I found to be interesting is the picture exchange communication system. In the journal article, Effectiveness of the Picture Exchange Communication System on Communication and Speech for Children with Autism Spectrum Disorders, it states that approximately 25% of people with autism never develop speech. Therefore, incorporating an alternative way for a child with autism to communicate at an early age in life is important. The picture exchange communication system is when an autistic child is taught to use pictures when they need to communicate to someone. A sequential line of pictures can be used to show someone with autism steps that are needed to do specific tasks such as brushing teeth or getting ready for bed. The line of pictures for brushing teeth would start with a picture of a toothbrush, then putting toothpaste on the toothbrush, then getting the toothbrush wet, and the last picture would be a picture of someone brushing their teeth. Another way to use pictures for communication is to use a portfolio like this one. It contains a variety of pictures such as foods, toys, and feelings. When he or she wants something, they take the picture out of the book and put it on the cover. An example would be, I want popcorn, and then thank you. Another example of this is to be used as a learning device. A teacher or parent could take a few objects and ask the child what they see. Then when shown the object, they would have choices to pick from. In this example, if the parent or teacher held up Play-Doh, the child would take the I see picture and move it to the top line of the book, and then take the Play-Doh picture and put it next to the I see picture. With all of the latest technology that is now used, computers and iPads also have apps that allow people to use this picture exchange system. After studying these different strategies that teachers and parents have used, this system seems to be very beneficial for the individual to learn and to communicate. Lastly, I will discuss communicating with an autistic person who is verbal and the importance of how you approach and talk to them. Almost 75% of people with autism are verbal. However, there can be a difference in degree ranging from little communication skills to quite complex communication skills. When talking to someone with autism, it is important to remember a few things. Always keep a regular tone of voice when talking. Loud, abrupt noises can scare them and also distract them from what they are doing. Although you and I have learned to use eye contact when talking to someone, avoiding eye contact while talking to someone who is autistic is important. This helps them feel more comfortable because they can either sense or know they are different from others around them. Lastly, try not to make any sudden movements or hand gestures while speaking. Just like loud noises, sudden movements also scare them. In conclusion, the disorder of autism affects the person's brain, social development, and the ability to communicate. Alternative strategies such as avoiding eye contact, abrupt noises, and sudden movements, and the use of picture exchange system have proven to help autistic people communicate effectively. Thank you.